Hello, a very good evening to all of you. Today we are going to discuss the case note of baby Ryan and baby Rohan, who are the patients in a newborn ICU where you are the NICU charge nurse. The hospital name is Royal Women's Hospital, Sydney. Now, mother is already discharged and babies are yet to be discharged. So this is what the background information is. You have mother Mrs. Angelina Michael out of the hospital, but babies are still in the neonatal ICU because of some complications. And let's see the complications after looking a glance at the writing task. Let's go with the writing task here. When we go with the writing task, you are requested to write a referral letter to Miss Daniela Robertson, newborn specialized nurse, Sydney Children's Hospital. Inform her the current situation, the medical background of the newborn babies, and requesting immediate management for both babies. So you are going to refer uh, baby Ryan and baby Rohan to Miss Daniela Robertson. Miss Robertson is to be informed regarding the current situation of the babies, the medical background of the babies, and we need to request an immediate management for both babies. So this is what we need to write. Now, let's go ahead with the age of the babies. That is 1 week old babies. So babies, they're just 1 week old. And her mother name is Miss Angelina Michael. And she had gestational diabetes mellitus. Father's name is there. Now we have one more child for this couple. That is Rayona Michael, 2 years. Now, Miss Michael was admitted on 8/1/2019. Cesarean session done at midnight. That it's about 9th. The day of admission was 8, so midnight in the sense 9th starting. It's at the midnight of 8, the day of admission. She got the discharge. She got the cesarean session done. Now, let's go ahead with the details of both the babies. The first baby, which whom we are going to discuss, is about Ran. And now Ran is, the problem is aspirated meconium. We have other problems like a decreased heart rate, increased respiratory rate, bluish discoloration of upper and lower extremities. So we have a few less Apgar score of 4/10 and poor sucking, oxygen 2 liter per hour, weight 2.5 kg. These twins are fraternal dizygotic twins. The diagnosis of Ryan was confirmed by an X-ray and a blood gas test, and the medical progress on 17 January 2019. So that's poor sucking here. So he had meconium aspiration. So if you see this meconium, aspirated meconium, both are expelled meconium. You can correlate this thing here. So you have the problem solved. But still, what is persisting on the day of discharge is poor sucking for the first baby. The problem of aspirated meconium, it is expelled. So we don't have that complication at present. At present, the baby Ryan is having poor sucking. And this is what you need to understand from this thing. So let's go ahead and see where the nursing management. We had prophylactic antibiotic therapy, and if we go in specific, what are the antibiotics? They are ampicillin and gentamicin twice a day. Radiant warmer therapy, IV fluid, DNS, oxygen therapy, CPAP for 3 days after delivery. So these were the treatment for Ryan, the first baby, and Rohan, the second baby. You can see the weight is 500 grams less than Ryan, and he too has poor sucking. Apgar score is slightly better than Ryan, that's 6/10. Heart rate is good, but respiratory rate is still low. So we have seen that the meconium is expelled. Now his problem here, the problem of Ryan was sucking, and here the problem is cleft lip and cleft palate. So this is the difference between the medical conditions of Ryan and Rohan. Now, what nursing management we have given to Rohan is that we, like Ryan, we have given DNS therapy, oxygen therapy via tent, and radiant warmer therapy too we have given. We have not given antibiotics, but we have given radiant warmer therapy, and this warmer therapy still needs to continue. He needs to continue this thing even after discharge. So this is something which is very, very important there. Now, the general discharge plan, it means the discharge plan for Rohan, the discharge plan for Ryan, and the instructions towards the mother too is included at some part. So when we go ahead with the discharge plan, the first thing that you can notice is that Roshan needs a radiant warmer therapy. Yes, we have already seen there. The sucking ability of both children should be monitored. The weight should be monitored. The IV fluid therapy should be continued for both the children, and you have to especially you need to consult a pediatric surgeon to address the problem of the second child, Rohan. Because he has to have an appointment for the surgery for correcting his cleft lip and cleft palate, and this is what we have. And last, we have an important thing that mothers should be given psychological support, because she is almost depressed and she has deep concerns over her children's condition. Now, the date here is 17 January. That was the last date given, and we selected that date. That's 17 January 2019. So the address is given. Dear Ms. Robertson, reference Ryan and Rohan, 1 week old. Now let's go ahead with the letter. This is the core of the letter. Let's go with the purpose of the letter. I'm writing to refer Ryan and Rohan, the twin dizygotic babies of Mrs. Angelina Mickle, who require immediate management at your facilities. So Ryan and Rohan require immediate management at your facility. So I'll explain how this thing goes. The thing which is highlighted here in blue is explanation of Ryan and Rohan. So I'm writing to refer Ryan and Rohan, who require immediate management at your facility. This is what the story is. But the explanation who is Ryan and who is Rohan is mentioned, is described in the middle, the dizygotic twin babies of Mrs. Angelina Michael. So this is a language presentation. So we have included the name of the mother too there, but the focus is still on the babies, Ryan and Rohan. And what they require is immediate management at your facility. What's a problem? They have poor sucking and congenital anomalies respectively. Okay, so the first baby, that is Ryan, has poor sucking. The second baby also has poor sucking, but we have to focus on this major problem, that is cleft lip and cleft palate. We have listed it under the main heading congenital anomalies, but we are going to say cleft lip and cleft palate inside the paragraph, so don't worry, we will be doing that. So we went with congenital anomalies in the purpose, with the purpose. So because we have to use another, so already we have used an and here. So if I am using another and cleft lip and cleft palate, so you have a lot of ands in between. So that's why we have said congenital anomalies. Anyway, we have to say what are the condition for Ryan in the paragraph. So not Ryan, Rohan in the paragraph. So let it be. Now, let's begin the letter. Ryan and Rohan were delivered via an emergency cesarean section due to fetal distress and cord entanglement. So due to cord entanglement and due to fetal distress, the emergency cesarean section was done for Mrs. Angelina Michael to take Ryan and Rohan out. Ryan had a birth weight of 2.5 kg, 500 gram more than Rohan's. However, his Apgar score was 4/10, 2 less than the latter. So this is a comparison. So the birth history, okay. So we have already mentioned the age of the babies at the beginning, that is 1 week old. So it is clearly understood that when the cesarean was conducted, it is understood. So it's a 1 week ago the cesarean was conducted. So it's not repeated. So we don't need to give the admission date or the date of the surgery or something like that. It's unnecessary data there. So birth weight is important. We have said 2.5, and we have made a comparison between Ryan's weight and Rohan's weight. It's 500 gram more. However, Apgar score was 4, which is 2 less. And so there is a difference between the Apgar score and the weight of the baby. So we have cleared it. Now we are going specifically to the baby number 1 and baby number 2. Upon further assessment, Ryan was found to have aspirated meconium and had poor sucking reflex. So we have assessed the Apgar score, we have assessed the birth weight. When we assessed further, we found that the baby was aspirated meconium, and was treated with antibiotics, DNS therapy, and oxygen vent. And he was also on CPAP for the first 3 days and was given radiant warmer therapy. So we have radiant warmer therapy, we have CPAP, we have oxygen therapy, we have DNS therapy, we have prophylactic antibiotics with amoxicillin and gentamicin. So all these things are there in the first paragraph, which describes Ryan's condition. Now, what about Rohan? Rohan has also had a poor sucking and was diagnosed with cleft lip and cleft palate. So now he had He had poor sucking and was diagnosed with cleft lip and cleft palate. Okay. Like Ryan, he was also supplemented with oxygen and was given DNS therapy. So it's very similar to the Ryan's treatment. So DNS therapy, oxygen, and radiant warmer. So no antibiotics for him. The elder baby had antibiotics, gentamicin and ampicillin. He didn't have any antibiotics, but he was supplemented with oxygen. He was in a radiant warmer, and this has to be continued till he gains weight. Now, right now, the weight is 2 kg. As in the coming days, if you are improving the weight, then you can stop the radiant warmer. Now, it would be appreciated if you could monitor the sucking ability and weight of both children and continue IVF therapy for them. So you have to assess the sucking ability of Ryan and Rohan, and you have to continue the IVF therapy, the intravenous fluid therapy. Why we have use the short forms? Because you're writing to a medical professional and we have a lot of words there already, so we need to go ahead with the abbreviations. So that's why we have used some abbreviations there, and it is medical abbreviation only. Please note that Rohan requires pediatric surgical consultation and his mother needs psychological support to overcome the situation. So Rohan requires pediatric surgical consultation and his mother needs psychological support to overcome the situation. So we have written paragraph number 1, the background, birth background, the weight, Apgar score, specifically to Ryan, what happened, meconium aspiration, all these things. The therapy is given to Mr. Ryan. And when it comes to Rohan, the second paragraph deals with the same treatment, oxygen, DNS therapy. The request paragraph, you have asked the nurse to monitor the sucking ability and weight of both children and requested to continue the intravenous fluid therapy for them. So the mother needs psychological support at last, and because she is depressed and has a lot of concern about the children, the babies. So that's it. But this is how an ideal presentation is. You can write another way is that the first paragraph will be totally dedicated to Ryan, the second paragraph will be totally dedicated to Rohan, and then we can do that. Because here in this particular letter, what we have done is the first 2 sentences we have said something in common and something we made a comparison, and then we have said separate. So if you are comfortable with writing Ryan's data and Rohan's data separate, it is well and good. It will not be creating any confusion. But beware that your word count is not exceeding the limit. So that's the only problem here, because you have a lot of content there. So that's it. That's the end of your explanation. Thank you.